Hello, everybody. Welcome. My name is Indu Spagnardi. I'm Senior Director of Community Health and Elder Care here at the Catholic Health Association, and I want to welcome everyone to today's Earth Day webinar, Heat, Floods, Breathing Bugs, Health Impacts of the Ecological Crisis and How Healthcare Can Respond. This webinar is part of the resources that CHA provides annually for its members and to others to recognize Earth Day and the connection between a healthy planet and healthy people. Before I introduce today's presenter, I'd like to begin with a brief prayer drawn from An Invitation to Ecological Conversion for U.S. Catholics, a Lenten reflection developed by the United States Conference of Catholic Bishops. And if we can go to the next slide. For those of us joining from organizations outside the Catholic Health Ministry, we always open our programs with a reflection that grounds us in our mission and values. This particular reflection calls Catholics and Catholic institutions to recognize our shared responsibility for caring for the gift of creation, to acknowledge our role in the current ecological crisis, and to listen to and take action on behalf of those most impacted, the earth, and the poor. I encourage everyone to read this reflection in its entirety. It's linked in the chat. Its values and call to action are universal and reminds us that we're all deeply interconnected with one another and with creation. So if we can take a moment, I will lead us in a brief prayer. O God, during the season of Lent, draw us into the desert, a place of fasting and prayer, removed from the distractions of the world. Help us listen to the voice of creation. Turn our hearts to you in our innermost space. Let us listen more carefully to creation, to others, and to you. Help us listen to the voice of creation. As we are touched in this listening by your incarnational presence, remind us of your love and mercy, your initiative and activity. Help us listen to the voice of creation. Show us your attentiveness and to the cry of the earth and the cry of the poor, to the little ones wounded by a throwaway culture, and to those suffering due to natural disasters. Help us listen to the voice of creation. Listening to the voice of creation, help us to join in holy witness to protect those most vulnerable and to protect our common home. Now, if we could go to the next slide, I'd like to introduce our presenter for today, Dr. Shatil Rao. She's a board-certified practicing primary care physician and assistant professor of clinical medicine in the Department of Academic Internal Medicine at the University of Illinois, Chicago. Dr. Rao is a 2022 Harvard Climate and Health Community Organizing Fellow, a 2023 University of Colorado Climate and Health Policy Fellow, and a 2024 UIC Teaching Sustainability Fellow, and a 2025 Op-Ed Public Voices Fellow. She's also a 2022 recipient of the American Public Health Association Climate Leadership Award. Dr. Rao designs and teaches sustainability and planetary health curriculum at UIC's School of Public Health and College of Medicine. Her work at UIC's NIH Center for Extreme Conditions and Health Excellence focuses on heat vulnerability and nature-based solutions. Outside of the clinic and classroom, Dr. Rao collaborates with local communities to increase tree canopy around the Chicago region through her not-for-profit organization, Nordson Green Earth. So as you can tell, she's a passionate advocate for making the connection between climate change and health. And we're so excited to have you, Dr. Rao. I'll turn the program over to you.
Thank you so much, Indu, for that wonderful introduction. I'm very grateful to Catholic Health Association for being here today with all of you. I have a lot of slides to get through, so I'm going to get started. So I'd like to start off with the story of how I got involved in this work. Just over a decade ago, my husband and I left our apartment in the West Town neighborhood of Chicago for a single-family home in the suburbs so that our two, at the time, toddler boys could have more room to run around in a yard and a basement And the day we moved in, some of our neighbors came over to welcome us, but they also warned us. And they said, this street sometimes gets water, just so you know. We've only seen it a couple of times, but the basements sometimes flood. They saw our worried faces and they tried to reassure us by adding, don't worry, it's really only with those 100-year floods. Unfortunately, over the next 10 years, our basement flooded 3 times. Two of the 3 times we had to tear out drywall and carpet and start from scratch, and my 2 toddlers were up running around in the kitchen and the upstairs because they didn't have the basement to run around in. And this is not my street, but this is how it looked. I remember after the third flood, my husband and I hauled sopping piles of carpet and padding to the curb. And we were looking up and down our street and saw identical piles lining the curbs of our whole street. And I began to wonder, what is going on? So I started reading, and I learned that a warming climate had led to increased rainfall in my area, and that certain land use decisions, like putting brick buildings and parking lots where there used to be marshes, combined with some outdated drainage infrastructure, was all causing the recurrent flooding. This was an aha moment for me because it showed me how increasingly extreme weather was already impacting my family and my community. And I knew we were lucky because we could afford to fix up our basement because insurance definitely didn't cover most of this. And we were able to upgrade our sump pumps, and our town had the resources to upgrade the stormwater infrastructure. But every time heard news about hurricanes and floods and extreme weather on the news, it hit differently after that. And I knew that some people were losing their entire homes and access to food, water, transportation. They were unable to refrigerate their medications, and they were unable to get to their doctor's office. Plus, they were suffering a lot of emotional stress because of all this. And though our flooding situation, knock on wood, has resolved for the time being, it took years for my husband and I to stop pacing the halls and checking the basement carpet every time there was a heavy rainfall. So I was not alone in thinking about how this was impacting communities and patients. As it turns out, several national and international medical societies and organizations like the New England Journal of Medicine, the WHO, and the Lancet were already calling climate change the greatest threat to global health of the 21st century. And they had begun rolling out policies, pledges, and certifications to help and address it. I do also want to point out that climate change is one portion of the triple planetary crisis. The other parts are biodiversity loss or nature loss and degradation, also known as pollution. So the reason that climate change has such a heavy impact on health is because it is in itself a social determinant of health. It also impacts nearly every single social determinant of health that there is. And many of us in healthcare know that these determinants make up the lion's share of our patients' modifiable health outcomes. In order to have healthy people, you need to have a healthy community based in a healthy environment and a healthy society. The planetary crisis also exacerbates existing social inequities like lack of housing, food, water, energy, and jobs, all of these social determinants. So this is a graphic from the CDC, and tying back to my initial story about pacing the halls every time it rained, you can see here that the mental health impacts, which is the kind of pink band, circular band, touches every single health impact of climate change, which are located on the periphery. And in the center, you see the drivers of climate change, like rising temperatures, or also their impacts and drivers, and they're all interconnected with each other. So we will be covering today pretty much all of these, but we're going to be honed in on 4 of them. So just an outline of how I'm going to address this topic, where I will start off by talking about what changes are coming and how climate change and pollution are affecting disease incidence and prevalence. And then I'm going to cover some individual actions with each of these that you can take to keep yourself and your community safe. We're then going to talk about who is most affected by climate change, and then we will end with how healthcare can respond. So I will focus on 4 of the health impacts of climate change, and those are going to be heat, air, water, and vectors. And we'll start off with heat. Uh, since the warming climate is a major driver of health conditions, that's why we will focus on this one. And heat is also the #1 weather-related cause of death in the US and worldwide. 2023, 2024, and 2025 are the hottest years on record globally, not necessarily in that order. And this year, 2026, El Nino is expected to push our already warming baseline temps even higher. So even though this is a cartoon, it's basically factual. And here you can see that a graph of how US temperature has been increasing. It's important to note that human-caused activities are contributing to most of climate change, and the temperatures have been drastically warming since the start of the industrial age. It's also important to note that winters are warming faster than other seasons, and winter nights are warming about 30% faster than other nights throughout the year. As a consequence, we have less spring snow cover, earlier thaws, less ice formation on lakes, which can affect the growth of mold, pollen. It can also affect how we grow our food and food sources for animals as well. It's not quite clear whether we can reverse any of the damage done, but the extent of future warming and its downstream health impacts depends strongly on the magnitude of our emissions now and into the future. We also know that the pollution-fueled climate change of 2025 will only intensify with continued fossil fuel use. Vulnerability to heat is shaped by both physiologic factors like age and health status, as well as exposure factors like occupation and socioeconomic conditions. Vulnerability is also shaped by policy. In fact, extreme heat is probably one of the best ways to clearly illustrate how policy change manifests in the form of health injustices. So this slide shows that these are areas that were previously redlined by the Homeowner Loan Corporation back in the 1930s, and the yellow dots are 108 US urban areas that were affected by redlining. And this paper showed that even though all urban areas experience some form of heat island effect, and this is due to 30% less tree canopy, more impermeable surfaces like concrete and asphalt and other built structures. So basically 94% of these cities displayed consistent city scale patterns of elevated land surface temperatures in formerly redlined areas as relative to their non-redlined areas by 7 degrees Celsius. So 7 degrees warmer on average in the areas that had previously redlined. So this just reveals that historical policy can, in fact, be directly responsible for disproportionate exposure to heat even today. So what you can do for extreme heat, I will include on every slide advocating for a just transition from fossil fuels. And that just means transitioning to renewable energy, but doing it in a just way, in a fair way. And then voting, of course, voting for climate champions will always be something that you can do for extreme heat and many of the other health manifestations of climate change, but also planting native trees. Using a heat risk calculator, there are many of them online. I'm going to selfishly plug one that I've been working on that you can scan here. Talking to coaches if you are in a sport or have kids that play about heat health risks and establishing protocols to protect them. Of course, hydrating, learning the signs of heat-related illness, and acting quickly, limiting activity when it's hot, especially in the hottest times of the day, cooling off. And then this one's really important, the last one, which is making sure that you and your family have a plan for air conditioning, because when everyone turns on their air conditioning when it's hot outside, sometimes there are power loss and rolling blackouts, and that has happened historically. And so it's really good to have a plan and check on others, especially people who live alone and have other vulnerabilities. So next, we're going to talk about air pollution. Climate change is going to lead to worsened air quality in the form of allergens and a particular form of air pollution called ground level ozone, as well as wildfire smoke. So the lungs of an average adult have a surface area capacity for gas exchange that is about the size of a tennis court. So whatever is outside us is very intimately connected with whatever is inside of us. And so this gives our body a lot of exposure to chemicals, particulates, microorganisms through breathing. Unfortunately, 99% of the world's population lives in areas that don't meet WHO criteria, air quality guidelines. And in the US, air quality is expected to worsen, as are greenhouse gas emissions after the recent repeal of the endangerment finding. So we know air pollution causes inflammation. It increases incidence and exacerbation of heart disease, stroke, dementia, pneumonia, cancer, diabetes, and COPD, among other conditions. It also translates to lost days of work, school, ER visits, and other healthcare utilization. Particulate matter is one type of air pollution. We're going to focus on just 2 or 3 of them today. So particulate matter comes in different sizes, as you can see here. It can come from natural sources like pollen, mold, dust, and wildfire smoke. And it can also come from human sources like car and truck tailpipes, as well as wildfire smoke. And then particulate matter is a size 10 micron. It can affect upper bronchi, so it's larger. It kind of stays in the upper airways more, can lead to coughs, shortness of breath, airway spasms. And then the smaller size can get deeper into the lungs and they can cause tissue damage, they can actually get into the bloodstream and they can affect all organs. So apologies for anyone who might be eating, but this is a photo that once I saw it, I pretty much shared it in every talk I've done about air pollution because it's just something that really stays with you. And it's a photo that's taken by Dr. Arvind Kumar. He's a cardiothoracic surgeon in Delhi. And he began to notice that the patients he was operating on who had never smoked had lungs that looked like smokers' lungs, even children. And he realized that this was due to the particle pollution caused by crop burning. In Delhi, there's a lot of crop burning, there's diesel truck use, coal power plants. And this really kind of gives you an idea of what can happen to health in an area where pollution is unchecked. Not only did the lungs look diseased, they actually don't function normally. So a third of the people who have that he lived in Delhi that he tested had abnormal lung function as well. And it's really important to note here that this damage begins in utero. So when pregnant women breathe this air, it affects their children. It also affects their heart and brain, where it can reduce IQ. And wildfire smoke also contains particulate matter 2.5. Another type of particle pollution will cause you to use more Claritin, Zyrtec, and Flonase this time of year, and that's pollen. And so we know that with warming caused by fossil fuel, we extend growing seasons, and this can lead to boosting of pollen. So many of us grew up learning that carbon dioxide is plant food, and that is true. And so one might think that because there's more carbon dioxide, that might be really good for plants and greenery. Unfortunately, increased levels of carbon dioxide in the air actually select for some plants that we might not want around. And some of the studies show that it can stimulate ragweed and grass pollen production, which leads to uh, more pollen emissions over time with warming, is the projection. As well as we also know that the seasons for flowering are longer, and in some cases, it can lead to more potent pollen as well. So the pollen itself is more allergenic. But our patients with respiratory disease won't just be grappling with more pollen, they'll also have to deal with ground level ozone. So there's kind of what we call the good ozone and the bad ozone. So the stratospheric ozone, you all may have heard of several decades ago when there was a hole in the ozone layer, and that is ozone that actually absorbs UV radiation and protects us. And that hole was fixed by us coming together as a global community and phasing out with policy chlorofluorocarbons in hairspray and refrigerants. And that hole was repaired. However, ground level ozone is closer to the ground. It is a mixture, or actually kind of a chemical reaction between some things that come out in tailpipe emissions, like volatile organic compounds and nitrous oxide that mix with heat and sunlight and create this ozone, which is an irritant to our respiratory tract and also can contribute to inflammation, decreased pulmonary function, worsening of asthma, COPD. It also causes and worsens cardiopulmonary disease and increases premature death. So this is one way that climate change can impact air pollution because with increased warming, we can have increased ozone creation. And this just shows in a map how ozone will be kind of projected to change over uh, in the future. So you can see here that yeah, climate attributable change is definitely worse in the Midwest, in some of the Northeast as well. And then ozone related deaths are increased in many parts of the nation based on the warming that we're foreseeing. So for air quality, some of the actions that you can take include checking local air quality, and I have a QR code here for the AQI. If you are one of the vulnerable populations that's listed in the AQI, if you must be outside, you can wear a KN95 mask. That can be very helpful for protecting your respiratory system. If it's always best to be inside if you can. I know not everyone has that opportunity if they have a job that's outside or need to be somewhere, but it's good to be inside with the windows closed. Have a good air filter. You could purchase additional ones if that's something they're able to do. Again, talking to coaches about the health risks of poor air quality and making sure that there's protocols to avoid outdoor activity. Kids in particular are very vulnerable to air pollution. They breathe faster, they're often closer to the ground, and especially if they're exercising, they're going to have a lot more intake of that polluted air. So it's really important that there's limitations around the exposure there on those high or poor air quality days. And then if you are inside, you can consider, or in your car, you can close the fresh air intake on those really bad air quality days and just sort of recycle the air that's inside of your home, assuming, of course, that the air in your home is high quality air. So you definitely want to avoid worsening it by cooking on a gas stove or burning candles, unfortunately. Uh, Candles aren't so great for the indoor air quality. So now we're going to move on to water. Warming temperatures, and I mentioned this earlier when I talked about the flooding in my own home, warming temperatures allow the air to hold more water, and that can cause more extreme precipitation events. Not only does flooding ruin homes and businesses and make it hard to get around, but it also ruins crops, causes soil erosion, and pollutes our water, which can make us sick. The immediate consequences of flooding are usually handled by our ERs and our urgent cares, like accidents and injuries. But flooding has a lot of other health consequences, like an increase in waterborne illness outbreaks. There was a study out of Ohio that linked combined sewer outflows, and I'll explain what that is, near homes. They increased the odds of kids going to the ER with a gastrointestinal illness by 16% when there were heavy rains. And and this usually, so in the Midwest, this happens when there's more than 2 inches of rain in a period of a day. And thanks to climate change, as you can see here on this graph, those 2 inch rains are going to become more frequent. So this is just an example, and I'd mentioned earlier that outdated infrastructure can be a big contributor to the health impacts of climate change. And this actually combined sewer outflow isn't such a big deal when there's dry weather. However, when the rain comes down really fast, what ends up happening is the water that's headed to the sewage treatment plant can combine with the stormwater and end up, as you can see in this photo on the top right-hand corner, in fresh water bodies and end up in our drinking water. And then sanitary sewer outflow is always separated, and that definitely reduces the possibility of water getting contaminated. So this actually affects 1/4 of the U.S. population, because 1/4, and a lot of this is in the Midwest and the Northeast, where we have combined sewer outflows. And so this is something that this actually 40 million people are impacted by this and are at risk of having gastrointestinal illness when there are high rain events. And some of you may be aware of organizations in your area that might be warning you or sending out alerts when it's raining, saying to avoid showering or doing laundry or using your dishwasher when they're high rain days. And that's because you can see illustrated in this photo how when there's extra water output, the risk for that combination is much higher. So here in Illinois, we have something called the Metropolitan Water Reclamation District, and they send out alerts telling people to try to avoid water use during those times. So what you can do during flooding, or to avoid flooding, or to be safe from flooding, is to sign up for those alerts, as I mentioned. Advocate for native trees and plants in the places where they're appropriate. Like rain gardens can really soak up a lot of rain and help avoid it from going into places where it's not supposed to be. If water contamination is a concern, remember to hydrate, not to drink the tap water. Boiling does not always help. And so it's good to have an emergency supply of bottled water or have a good filtration system. And last but not least, in terms of the health impacts, we're going to talk about vectors. So a vector is an organism, usually an insect, that transmits pathogenic microbes like bacteria or viruses from one host to another. And they cause disease. They can, in humans, not just humans, but plants and animals as well. And so these insects are basically like an intermediary, and they harbor the disease agent. They don't usually get sick from it, but they transfer the illness to a new host through a bite or a sting. And that's what causes vector-borne disease. So I will focus mostly on ticks and mosquitoes, which I think many of us are familiar with, no matter where you live in the country. So these maps show the reported cases of Lyme disease between 2001, 2014, as well as 2023. And these are the areas where Lyme disease is most common. And you can see how much the incidence of Lyme disease has increased over the last couple of decades. Um, so a little bit of this actually is due to better testing and recognition and diagnosis of Lyme disease. However, the lion's share of this is actually because of warming winters, expanding tick habitats due to climate change, as well as rising deer populations. So here is what some of the different sizes of the Ixodes tick look like. So, and that is the actual tick that causes Lyme disease. And what's important about this slide is I've had the life cycle of the Ixodes tick here. And the parts of the life cycle that are during warm weather are some important parts of their life cycle. So they grow more during warm weather, they attach to the host during that time. And so the risk of infecting humans with warming in our climate actually goes up, especially in the late spring and early summer when those seasons are prolonged and even warmer than usual. We will be seeing more of those infections. On to mosquitoes. So the Anopheles mosquito is well known as the vector for malaria, and most people will associate malaria with tropical climates. However, malaria used to be endemic in the US, and it was actually a pretty common diagnosis in the 1800s, but we eradicated it. And we are seeing it come back with a few endemic cases in the South, as well as one case in Maryland a few years ago. And the Aedes mosquitoes can transmit yellow fever, dengue, chikungunya, and Zika. That being said, most of these diseases are expected to become endemic in southern parts of the U.S. So we will, in our healthcare system, need to start thinking about these diseases in patients that are coming back from, for instance, winter homes in Florida. And then the Culex mosquitoes are the ones that are uh, responsible for viral encephalitis, different kinds, including West Nile. And these are already present in many of our geographies, but warming will lead to increased incidence of these diseases as well. So what you can do to prevent or protect yourself from vector-borne diseases includes applying an EPA-registered insect repellent. And there is actually a website. The EPA has um, a, a little box that you can type in information about what activities you're doing and helps you pick an appropriate repellent. Of course, avoiding areas where these vectors are common. Stay on the trails when you're in forest preserves, and then cover your skin as much as possible. Check your pets, check your clothing, shower after being outside. And if you see a tick, remember to remove it with tweezers, and you can take it to the doctor's office if you need help identifying it. So with this, we are going to pause for a second and um, let you all put into the chat, how has climate change affected you personally? Definitely seeing fires, wildfire smoke, allergies, poor air quality days, wildfires, severe weather, definitely. Yeah. Heat. Thank you all for sharing. Yep, heat is definitely a big one. Right, and I'll let you all keep sharing in there. Water concerns, early melt, absolutely. All right. But feel free to continue sharing, please. So I'm going to move on now to who is most affected by climate change. And this slide, even though it says heat impacts, actually does a pretty good job of talking about our most vulnerable populations from all climate change impacts. So children, seniors, women, particularly pregnant women, and all of our medically vulnerable patients. People who, so really it comes down to your inherent characteristics that might increase vulnerability, like age or pregnancy or disease, but also your exposure. And so, for instance, if you're someone who works outside, or if you're someone who is unhoused, that exposure is going to vary. And then there's also your the situation you're in. For instance, your vulnerabilities like incarcerated populations, people who live in low income communities who might live next to polluting plants, for instance, or urban heat islands. And those all those factors kind of come together to influence who's vulnerable to climate change. And our own State Department has called climate change several years ago a risk multiplier. And what that means is if you're already vulnerable in general to illness, and it actually, climate change will make you more vulnerable. So it's a risk multiplier. But I do want to highlight that it's really everyone that is at risk from climate change. And there are, of course, some people who are more at risk than others, but no one is fully risk-free. And another really important factor here is the cumulative impact. So there are some people who live in areas that are going to, like I said, living next to more polluted areas or areas that don't have as many trees or have industry or highways near them. Um, People who face more structural discrimination, people who don't have necessarily access to healthcare or don't speak English. And there are people who have multiple of those factors, and so those impacts are cumulative. And then in addition, we live in a time where there are threats to several social safety nets, and those can increase the vulnerability as well. So if your access to healthcare is threatened, for instance, and you're feeling sick from heat, you might be less likely to go and and seek care. Sorry, I'm getting over a bit of a cold, and seek care. And then also reduced environmental protections, such as the repeal of the endangerment finding and others that we may have heard about in the news recently. So the kind of final portion of my talk is around how healthcare can respond to all of this. And it's important to start off by knowing that healthcare is a big contributor to climate change. So we make up 8.5% of all US emissions. And globally, we make up nearly 5% of emissions worldwide. And of those global emissions at 4.4%, a third of that comes from the US. So the US plays a really huge role in global healthcare emissions. And if healthcare was a country, it would be the fifth largest greenhouse gas emitter in the world. And this is just an illustration from the New England Journal of Medicine, and it shows the different ways that healthcare contributes to greenhouse gas emissions through scopes. So just you could take a quick look. I unfortunately don't have time to go into it, but definitely a lot there to read about. So, climate change also affects our ability to deliver care. It makes our job harder and it makes care more expensive. So, it increases the cost of care because it increases healthcare utilization. It can contribute to pandemics by bringing, through nature loss and other ways. And then supply chain, I think many of you might remember with Hurricane Helene in North Carolina, it affected a Baxter plant, and that makes something like 60% of all IV fluids in healthcare centers in the US, as well as peritoneal dialysis fluids. And so several hospitals were impacted by IV fluid shortages, and this was because of this one hurricane. In addition, climate change threatens our infrastructure. According to the Kaiser Family Foundation, something like 30,000 patient beds are at high risk from dangerous flooding across the US. Staffing is also impacted by healthcare or by climate change. So many healthcare workers live in communities that surround their healthcare centers and hospitals, and it's difficult to get to work. This was illustrated in Hurricane Harvey, as well as some of the wildfires that we've seen in the news. And then last but not least, access, because of course, if the hospital is flooded or if your home is flooded and you're not able to get to the doctor, we're going to see some impacts on access. So the healthcare industry actually carries unique vulnerabilities because climate change not only increases the demand for healthcare services, but it also impedes our ability to respond. And so physicians and really anyone who's making decisions in healthcare will need to understand the cascading nature and intertwined nature of climate threats in order to build more resilient healthcare systems of the future. So here is another opportunity to put into the chat, how has your healthcare system been affected by climate change? Yeah. Sicker patients, shortages, a lot of supply chain, landslides, yeah, HVAC, energy, definitely. I saw from above too, turbulence that is from the previous question, that is true. Climate change does increase turbulence and also less reliability of flights, which there's a lot of issues right now going on with airports. I'm sure many of you are familiar. All right, coming back, workforce impacts, facility resilience, hospital damaged by a hurricane, clinic burned by a wildfire. Absolutely. Yep, so it looks like many people are already seeing this. So we have an ethical imperative because we produce emissions which accelerate climate change, which worsens health outcomes and causes disease, which then increases the need for healthcare. So this just really simplifies why we are compelled to act. My next slide talks about how we can act. And I apologize for the colors. If you were taking a nap, you are now awake. I did try to change the colors, but I was not able to. But this is a slide that my colleague, Dr. Caroline Skolnick, and I we came up with this acronym called G-STAR for some easy ways and actionable ways that people can make changes in order to increase their uh, sustainability at their healthcare center. So it starts with gloves. So G-STAR stands for gloves, scripts, testing, active lifestyle, and red bag waste. And of course, there are many other um, possibilities as well, which I'll talk about a few more in the next slide. But gloves, so 59% of patient encounters use gloves inappropriately. And those, of course, end up most of the time in landfill. Sometimes they're even burned, which is even worse. And so knowing what really constitutes the necessity of gloves, basically dealing with body fluids and just examining a patient, is not doesn't necessarily mean you have to put on gloves. With scripts, it is using PO where you can converting in the hospital, converting over to oral meds from IVs when you don't need the IVs anymore. The IV meds definitely have more of a climate footprint. They're also more expensive. So what you will see is that the theme here is that a lot of this is just better medicine, and a lot of this will be actually cost saving. So switching over from IV to PO is recommended as soon as it's appropriate. And then also using dry powder inhalers or mist inhalers over the MDIs, which the MDIs have a propellant, which is a very potent greenhouse gas. And so trying to use the more climate friendly inhalers is always preferred when it's appropriate. And all of this is, of course, only when it's appropriate for the patient. We're not going to we don't have to ever sacrifice patient care for any of this. So I just want to make sure I mention that. But for insurance, if sometimes the insurance doesn't cover the DPIs and the mist inhalers. So even if you just use a spacer, that more of that medicine gets into the patient's lungs, and that's a pretty inexpensive way. And sometimes, and obviously even makes the medicine more effective. And then with testing, so every single test not only has emissions, but also, of course, is cost and discomfort to the patient a lot of times. And so getting those morning labs every single day, just really think about those and being judicious. Do we really need to get those? Imaging, and I'll talk about that a little bit more. That's the one that I'm going to kind of get into a little bit, since there isn't time to get into all of them into detail. And then the next one is active lifestyle. So nature prescription. So of course, some patients just need medication. And so when appropriate, that should always be prescribed. However, prescribing things like lifestyle medicine interventions, active transport, plant-based diets, all of that is not only healthy for the climate, but also healthy for people and also pretty inexpensive most of the time. And then lastly, red bag waste. So red bag waste is really only supposed to be used for really soiled body fluid, blood type of items, because that gets incinerated. And so it has very toxic emissions. About 92% of the time, the stuff that's in red bag waste is not supposed to be in there. It's also a lot more expensive for your hospital to dispose of. So again, that kind of intersection of better care, better for the climate, and cost savings. So these all illustrate that. And a lot of this comes from Choosing Wisely Canada, which in medicine, we use something called Choosing Wisely, which is really just good care and being judicious with cost as well. And it's evidence-based. And Choosing Wisely Canada has done a really good job of adding the climate component as well. So just to talk about imaging because I just found it so interesting. So MRI is usually considered the highest carbon intensity imaging tool. So getting one MRI is the equivalent of driving a new European car about 90 miles. Getting a CT scan is a little bit better. It's about 47 miles. An X-ray is better, and the least emissions is an ultrasound, which is about 2.5 miles, just to put that in perspective of how much emissions each of these modalities puts out. And it's not even the use of it and actually getting the imaging. A lot of times it's just the standby, the power that it uses while it's on standby. And so that's definitely something to kind of look at. What's interesting for X-rays is most of the emissions come out of the laundering of the linens that people have, like sheets and pillowcases that they use, that patients use when they're getting X-rays. So just found that kind of fascinating and worth sharing. And here's some other behavioral changes, examples. So again, plant-based is a huge climate impact and something you can do at home too, even if it's just one day a week. Focusing on reusable, discontinuing isolation as soon as it's appropriate, because that is not only wasteful, but also very expensive. Pharmaceutical stewardship, telehealth. The surgical kits are huge because actually the OR, I think 70% of hospital waste comes from the OR. And I know there are some great interventions for a lot of these already happening. Using MyChart instead of printing and really trying to limit things like water bottles in the hospital, in the cafeteria, and at our conferences because they're so wasteful and most of them don't get recycled. So all of this comes to it comes to kind of one point, which is really starting to think more circular instead of linear. So instead of taking something, making it, using it, and throwing it away, taking it, using it, repurposing it, repairing it, and then reusing it again. So that's kind of the thought we want to get into. Thought process is whenever that's possible and aligned with patient care. So speaking of circular economies, I'm going to go on like a little short tangent before I wrap up. And this, one of the best examples of a circular economy, if you can call it that, is a forest. And I want to put on my other hat right now. And when Indu introduced me early on, she had mentioned that I have a nonprofit, and that nonprofit is called Nordson Green Earth Foundation. And one of the things that we do is we plant tiny forests. So we planted this one. This is the first Miyawaki tiny forest in Illinois, and it was planted in Cook County. And you can see this is an aerial view of it from a drone, and that you can see some of the biodiversity that is growing there. And the reason I bring this up is because this is the Catholic Health organization. This is a story that's related to the Laudato Si. So just giving you a little more background on the forest. This is the courthouse. This is what it used to look like before it was a forest. And this is the community of Markham, which is a south suburb of Chicago. And it's definitely a community that has dealt with a lot of pollution, the Highways Acts, if you're aware of those. So a lot of climate injustices, but just a wonderful community, very close knit, and has welcomed us. So this is what the first few pictures are, some of the pictures of the planting. This was day one, and then in later on later on that year in July and just a few months later, and then most recently in this past June, you can see how quickly these forests grow. So if you're not familiar with Miyawaki forests, they are these quick growing native forests that could reach maturity in 20 years. And this was our planting day. So we had 25 middle school kids lead the planting, 75 volunteers, more than half were from the local community. And one thing I love about planting is in a time when we can be so divided. There's few things that connect people more than crouching shoulder to shoulder in the dirt, getting your hands dirty, and working together to plant something that is really hard to find something more hopeful than a tree. So this was just a really joyful day. And now this brings us to why I brought this up is because so even though we're a 501c3, we're not religiously affiliated, but last fall we were really honored to have our tiny forest be part of a season of creation pilgrimage inspired by Pope Francis and the Laudato Si encyclical, which encourages urgent action against environmental degradation and climate change. So this was an event that was hosted by the Congregation of St. Joseph and the Well Spirituality Center out here in the western suburbs of Chicago, near where I live. And we had some local politicians come out and speak as well. And so it was just a really lovely event. And I just wanted to share that with all of you. So that brings me to my final slide, or second to last slide. So now that we've covered some of these significant impacts, and some of this can be really heavy, I do want to keep you all to keep in mind that addressing all of this often has multiple benefits. So planting trees, again, to use that example, not only gives us shade from heat, the leaves purify the air, they give homes to birds and biodiversity. Some of those birds eat those mosquito vectors, but this is just one example of not only how the kind of health harms are intertwined, but the benefits are intertwined too. So you can do one good thing and actually do a whole bunch of good things just by doing one. And I also want to highlight this great quote from Healthcare Without Harm that says the worst effects and causes of climate change can be prevented. And this is actually an opportunity for us in healthcare to improve health outcomes and increase health equity. And I love this little meme, which is so true, which is in these movies like Back to the Future or any kind of like time travel movies, they're so worried about changing one single thing when they go and travel to the past because they might radically change the present. But it actually goes both ways because we don't usually think about it this way, but we can change one little thing and we can maybe radically change the future for the better. And so I hope that today you were able to find one little thing that you can change starting today or tomorrow that will radically improve something in the future in terms of our Earth. Thank you so much for the opportunity to be here today. I am sharing a QR code that has resources if you'd like to learn more about this topic and some ways to get in touch with me or learn about Norts and Green Earth.
Thank you, Dr. Rao. I have to tell everybody I've heard Dr. Rao present on this issue before, and after I heard her, I said I have to have her on to present to our members because you have such a wonderful way of taking something that can be kind of complex, but making it really understandable for a range of folks, not just medical doctors. So thank you so much. And I love how you ended on a hopeful note because I do think this is an opportunity for
Oops.
healthcare to lead the way in terms of addressing the climate crisis, mitigation, but a lot of the things you talked about was about building resilience, how to protect, how to be educated and how to protect ourselves. So I want to open it up to the audience to please share any questions that you might have for Dr. Rao. There was one question that came in already around the acronym that you shared. And someone asked if you could talk more about or repeat the issue with the glove use.
Yes, the acronym was G-STAR, the glove use. So I think it was something like 59% of the gloves that are thrown away didn't necessarily need to be used. So Um, so there's a lot of inappropriate glove use, which just means that if you're just examining someone and if their skin is intact and you're just doing a regular exam, you don't necessarily need to wear gloves for that. So it's really more kind of like just hand washing. Of course, if you're dealing with something more complex, body fluids, injuries, et cetera, bleeding. So there are like guidelines on proper use of gloves and we can find those, but there's just a lot of people just throwing gloves for everything. And so that's kind of what I'm talking about is not so much not using them for things that they need to be used for, but like making sure that they're used appropriately. Otherwise, they just end up in the landfill.
Again, the chat's open for questions, but I'm gonna, while we wait for the questions to come in, I'll just ask a few. A lot of what you talked about is education, and like with the issue with the gloves, um, physicians need a lot of education on what can be changed. But I was also thinking from a patient perspective, I'd be a little worried if my doctor didn't put on gloves, you know? So I think, how do you address that issue with not just specifically for the glove use, but maybe we'll start with physicians because you're a physician. How do you start that conversation in a healthcare facility?
Yeah, I think the way I'm thinking about it is I'm a primary care physician. So I'm in the clinic. I'm not doing surgery. So obviously if I was doing surgery, you have to wear gloves. I'm not doing procedures. So rarely am I doing a procedure. So usually I'm just kind of listening to people's hearts and lungs, examining their knee, things like that. Once in a while, if there's something that's an open wound, of course, I'm going to put on gloves. If I do a pap smear, I'm going to put on gloves, of course. But if I'm just going to listen to someone with my stethoscope, I don't need to put on gloves. So I'm kind of coming at it from that angle. I think it's probably easy to see it the other way, where if you're, have a surgeon who's not wearing gloves, yes, of course, that is problematic. And then hand washing is necessary in any patient encounter, of course. But that's kind of what I meant about it. I don't know if that answers your question.
Yeah. Um, so I loved your slides about what you can do, but a lot of what you were talking about sounded like it could be good community education efforts, like, for example, reaching out to schools, athletic programs. You said you work in a clinic, so educating patients when some of these weather events come up. Can you give us some examples or tips for our healthcare organizations? Because we do have connections with community members or things that you've seen that have worked well in that aspect.
Yeah, well, there's something, a resource that is put out by Eco America called Climate RX. It's a Climate RX badge. It's just like a little badge that can affix on like the back of your regular hospital badge. And it's got a QR code on it. And so it's one way that if patients want to talk more, I know again, coming from the primary care doctor perspective, our visits are so short and there's so much to talk about. So it's hard to go kind of on a tangent about, and I wouldn't say it's a tangent because a lot of times it's related to stuff that they're coming in for, but to kind of go on a different topic about into depth about climate change. But it could be something, for instance, so they'll come in for allergies, and I might say, oh, allergies have been getting worse with the warming we're seeing. Oh, and they want to learn more about why is that or why is climate change affecting allergies. They can scan the badge and they can learn more about how climate change impacts allergies or heat, for example. There's a lot of content around that. So that's one resource that saves a lot of time and gives people more research, more of an opportunity to learn. And I think that's worked pretty well for people that have used it. In terms of communities, I think that it's always great if you have a connection, like a school, if you're a parent, or you're
Mhm.
school board member, and seeing if you can connect with a teacher or a principal and say, I'd like to do some education. Or you can go speak at a school board meeting and say, hey, this is really important to me. This is something that I know about because I'm a healthcare practitioner and I see more patients with this and this, and so kind of saying that could I have an opportunity to just even going somewhere and saying it, even at a school board meeting, there's a lot of people that listen to those,
Yeah.
or writing a letter to the editor or an op-ed in the local paper. So those are just some forms of advocacy that, and then in terms of community organizations, I think there's definitely opportunities, but if you have a connection, kind of reaching out and saying, hey, this is a problem that our group is affected by or community is affected by, could I come in and do some education around that?
And I think it makes a big difference to have a medical professional come in and talk about it. Like you said, it first of all can make it less polarizing. It's not a political issue. It's just about
Yes.
health.
Health, exactly. And
Yeah.
actually, I should mention that the Medical Society Consortium for Climate and Health is a national organization and they have a lot of state branches. So in Illinois, we have an organization called Illinois Clinicians for Climate Health, and there are other ones in many other states that you can look up for your state and see if they might be willing to come out and give a talk, because there are a lot of healthcare workers, not even just physicians, nurses, and people with healthcare backgrounds that have expertise in various topics like heat, air pollution, et cetera, that would be happy to come out and meet with your organization to do
That's a
education.
great resource. And we will put these resources in the follow-up email, but the Medical Society Consortium on Climate and Health is an excellent
Yeah,
resource that has is very active. So that's a
yeah,
great
yeah.
recommendation. Um, so we're talking about organizations like kind of, who can provide assistance. Are there like, what are your top three? Like if you're just getting started in this as a healthcare organization, um, who should you be considering partnering with or becoming a member of for
Top
these types
three.
of
Oh,
resources?
there's so um that's tough. There's so many great ones. And I did actually in that QR code that I included at the end has links to a lot of these organizations. So
Mhm.
the Healthcare Without Harm is really healthcare focused. I know that the National Academy of Medicine has wonderful resources as well. Um, I know the AHA has an environment group that we're a part of, and they've
Right.
got some resources. So, and then let me think. I'm sure I'm going to miss something. There's educational resources through Columbia, and it's called the GCCE, the Global Consortium for Climate and Health Education. So for educators, there are
Okay.
resources like cases and things like that. If you're teaching students, there's some ready-made, ready to go kind of cases. So it kind of depends on if you're looking at like hospital sustainability or like more patient education or more like learner education. So there's something for everyone.
That's great. And Healthcare Without Harm and Practice Green Health, we always
Yeah.
say is kind of the go-to organization to just get started because their membership is so wide. They've got folks like you, but they've also got administrators, facility management, the whole range of within a healthcare organization. So again, I want to make sure, I know there was a lot covered, but if folks have questions, please feel free to put them in the chat. And we have a little extra time to answer questions. I'm going to, while we wait, just ask a couple more. You talked about the vulnerable groups that really are disproportionately impacted by climate change. Do you have recommendations on how to reach out to those groups in particular, or to be aware of them, uh, if you're at a clinic or at a hospital, to meet their needs more intentionally?
Yeah. I think a lot of hospitals have connections with like local NGOs. And
Mhm,
I think that that would probably be the best way to start is there's people already doing that work in the community and
mhm.
just seeing how the healthcare system can support that, whether it's through education or meeting space or something like that to really reach those groups. There's climate justice organizations in probably every major city. And so kind of looking at what's already out there and just seeing how you can support that great work, because those are the people that know the best. And I would really just reach out to them.
And I want to reiterate that I think sometimes we in healthcare can think we know it all. And this is an area where we really have to respect the wisdom of the community, their lived
Yeah.
experience. Well, we have one question here that's come through. What has changed in your work with the current federal administration changes? Have you had to change your go-to sources due to HHS changes?
There were a lot of resources that I would use that are not available in the regular website, I guess, but there have been some people that have, I think, archived those, and there are different ways to get those resources. So I would say they're still out there, but it may not be at the exact government website they used to be at.
And I think Healthcare Without Harm and Practice Green Health have taken the health sector climate pledge on, and they might be a first place to go to see where those
Yeah.
other resources have been moved. They try to take on that leadership role. Um, well, thank you, Dr. Rao. We have one question about can we get uh, materials and presenter? I'm not exactly, uh, I think the question might have gotten a little garbled. Your material, your PowerPoint, and the recording of this webinar will be shared with everybody who registered. And I think when I did your introduction, you're really great about speaking. I've heard you've spoken to your local radio station and different venues. So I know you have a busy schedule, but if people want to reach out to you,
Sure, yeah,
I hope that's okay. Um,
sure.
and just again, thank you so much. Your passion is very inspirational. It's a lot of heavy material, but I feel like you've given people the knowledge to know how to prepare themselves, but also how to take action. Like I shared in the beginning, the reflection from the Catholic bishops is we need to listen and discern, but we also have to take action on this issue. So thank you very much. We're wrapping up. I think my colleagues will put in the chat a link to a quick survey. If you could take just a few minutes, I think it's only 3 questions to let us know, 4 questions to let us know what you thought of the program, and also if there are other issues you'd like us on this topic to address. We talked a lot about the impact of climate change on health. Are there other topics you'd like us to get more into? We'd love to hear from you. And also, I think we're going to have a link to our annual meeting, which is called the CHA Assembly, will be put into the chat. We'd love to see you in St. Louis this year. It's a great program for those of you in Catholic healthcare. And once again, thank you so much, Dr. Rao. I know our paths will cross in the future for a little bit because we're on a work group together, but I hope that we see more of you in Catholic healthcare with your presentations and sharing your knowledge.
Thank you so much.
Yes.
Thank you for including me.
And thank you, everybody, for being with us today. Have a great rest of the day. Thank you.